Okay, Dean, you want to start now?
Yeah. Okay, hi everyone. My name's Dean. I'm a sports psychologist and PhD researcher at York St John University. Today's presentation will be looking at managing athlete perfectionism. So it follows on quite nicely from where Andy had left off. So in terms of the layout of the presentation, I'm going to look at what perfectionism is with a slight focus towards perfectionistic cognitions. I'll then provide some of the research that's looked at managing perfectionism inside of sport, and then provide you some of my own research that's looked at the topic, and then provide you with some takeaway messages at the end of the presentation. So what is perfectionism? So Frost and colleagues, as Andy described earlier, tends to be the preference in regards to the definition of perfectionism. So it's a personality characteristic that includes setting exceedingly high standards of performance and tendencies for overly critical evaluations of one's behaviour. So from this particular paper as well, Frost and colleagues describe perfectionism as this kind of multidimensional characteristic that's made up of these 6 dimensions. Now, these dimensions were incorporated into Hewitt and Flett's perfectionism model, which is made up of these 3 dimensions. So firstly, self-orientated perfectionism, so which is this kind of demand of perfectionism from the self, i.e. being incredibly harsh or showing harsh self-criticism. We then have other-orientated perfectionism, so demanding perfectionism from other people, i.e. critical of others' achievements, and socially prescribed perfectionism, this kind of belief that other people demand perfectionism from oneself, i.e. others are critical of you and your achievements. But ultimately, because of all of these different measures and different subscales of perfectionism, which Andy had gone through during his talk, and these are the kind of like a selection of those, and I've just gone through a couple of, in terms of Hewitt and Flett's and Frost's models just earlier. The easiest way for us to try and understand it in regards to research and practice is focus on what's called the hierarchical model of perfectionism. And this provides us with 2 kind of overarching constructs, which are perfectionistic strivings and perfectionistic concerns. So perfectionistic strivings firstly, so we often see it being related to self-orientated perfectionism and other-orientated perfectionism. So that was from the Hewitt and Flett's model. But it's also related to things like personal standards and organisation, which are 2 of the dimensions from Frost's model, along with other dimensions and scales, including striving for perfectionism, which is Sobar and Otto's model. And then we've got perfectionistic concerns, which is related to socially prescribed perfectionism, concerns of mistakes, parental expectations and criticisms, doubts about actions, negative perfectionism and negative reactions to imperfection. In regards to the research, we often see perfectionistic strivings, as Andy had described earlier, have a mix of different findings and generally accepted as a very complex construct to understand. In regards to perfectionistic concerns, however, wholly maladaptive, related to a whole host of problematic outcomes for both mental health and performance. It's because of that we need to point our attention and our focus towards trying to understand the concerns element within perfectionism further, and trying to manage that construct with greater attention. So perfectionistic concerns reflect the concerns about making mistakes, this kind of fear of failure. There's a feeling of discrepancy between one's standards and one's kind of actual performance, and then a negative reaction to imperfection. But there's also a cognitive component within this, which we know as perfectionistic cognitions. So up until now, we've kind of talked about perfectionism as this kind of multidimensional characteristic that we refer to as a trait. Perfectionistic cognitions, however, are kind of this state dimension. So under different circumstances, conditions, contexts, we would see that kind of level of perfectionism change given that kind of circumstance. So what are perfectionistic cognitions? Perfectionistic cognitions are essentially automatic thoughts, ultimately about the need to be perfect. They focus on the individual difference rather than this kind of trait that we've been discussing previously. They mediate between high levels of perfectionistic concerns and anxiety, And I guess trying to manage these, we need to assess the frequency of the thoughts. So, for example, if an athlete is having very frequent perfectionistic cognitions or thoughts, they will have far more problematic outcomes. So we need to try and reduce those thoughts and the frequency that athlete is having those thoughts through interventions. So managing perfectionism. The research around this inside of sport is pretty scant, it's pretty limited, and there are only 4 published studies that have tried to reduce perfectionism or manage perfectionism in some way. So these are the first 2, both in 2009, were a series of studies, firstly by Kaufman and colleagues, and then the follow-up study by Dipatrio and colleagues. Both interventions use this kind of 4-week-long mindfulness-based intervention. Both studies used a control group and an intervention group as part of the delivery of the intervention. And in terms of the results and what they found, that they, because of the intervention, there was a decrease in parental expectations and parental criticism. And there was also some decrease in some of the consequences of perfectionism, such as anxiety and worry. So, really important studies that I often refer back to. They've laid the foundation in regards to how we go about managing perfectionism, and really important in that regard. The third study, this time by Amber Mose, which Andy made reference to a little earlier, in terms of the intervention, this was published in 2013. In terms of the intervention, they use a 7-day self-compassion intervention. So there was different writing tasks and mindfulness-based exercises over a 7-day period. They used 25 self-identified perfectionistic athletes. In terms of the research design, they use an RCT, so really gold standard design of research. They found that there's a decrease in self-criticism, so this is one of those aspects of perfectionism, and also decreases in rumination, the amount of thought and worry in relation to their perfectionism. So ultimately, again, really positive findings based on this idea of increasing this kind of compassionate mindset in a group of athletes. And then finally, the last published paper by Tracy and Andy Hill, again made reference to by Andy a little earlier, again using an RCT, this time though with 115 academy footballers, again self-identified as perfectionistic, and they received over an 8-week period this kind of CBT, psychoeducational self-help book that they athletes had access to for up to 8 weeks. They found that there was a decrease in perfectionistic cognitions. That was something they actually measured, which was really useful, something that previous studies hadn't done. And there was also a decrease in anxiety, this kind of consequence of perfectionism. So I just want to point to some studies that I've done along with my research team and PhD researchers at York St John in regards to trying to manage perfectionism. Both these studies are actually unpublished. Hopefully they will be available in the next 12 months or so. The first study, using what we refer to as a single case design with a group of 5 international basketball players. The intervention that they received over a period of 4 weeks was a psychological skills training intervention. So they had things like goal setting, relaxation, self-talk, imagery. From the intervention, we found there was a decrease in anxiety in this group of athletes who were perfectionistic, I must point out. So we found there was a decrease in anxiety and also an increase in some positive emotions, but we didn't see any change in perfectionistic cognitions. So we kind of concluded from that study that PST, the psychological skills training intervention, can be used as kind of a short-term solution, short-term relief to some of the problematic consequences of perfectionism for perfectionistic athletes. But if we're ultimately looking for kind of long-term change or long-term effect, we need to point our direction towards cognitive behavioral approaches such as CBT, REBT, and ACT, which outside of sport have all been shown to be pretty useful and effective at reducing perfectionism. The second study that I want to make reference to, again unpublished, but hopefully will be available at some point soon. Again, using this kind of single case design research, this time with 4 high performance rugby league players. The intervention they received was acceptance and commitment therapy, so trying to take some of that knowledge from the earlier study in using one of these cognitive behavioural approaches that have been used outside of sport. We had found that there was a decrease in perfectionistic cognitions, an increase in happiness and wellness, as well as psychological flexibility. And so we could safely assume that over a longer term effect, that was something that the intervention had produced. And some takeaway messages, this specifically for coaches. And obviously we know that the coach plays such an important role in helping athletes access various coping resources, and that should be the same for perfectionism. So for example, we know that psychological skills training has shown to have some short-term relief, albeit used with caution, but as an expectation, as a minimum, athletes should be able to access that kind of support to help them with their perfectionistic tendencies. In regards to the support structure, I think coaches can ask themselves several questions, including, do we provide enough empathy? Do we, focus towards providing solutions? Are we aiming towards, a similar goal? And I think these are some questions that coaches can ask themselves that might bring about a facilitating development of a stronger support system and structure for athletes to thrive within. And finally, something that coaches and sports sites can do is develop this kind of compassionate mindset for athletes, helping them be kind to themselves during periods of failure or turmoil, and trying to revert away from this kind of idea of being overly self-critical, which we know now is incredibly destructive for their mental health and performance. And now I'm happy to take any questions. I'll just turn this down and